In today's video, we're covering 10 things that you can do right now to reduce your lower back pain and ultimately make a complete recovery and rebuild your back strength so that the risk of back injury going forwards is reduced significantly. We're going to get straight into it with number one, and that pertains to sitting. We spend too much time every day sitting down in chairs at work, at home, around the dinner table, on the way to and from work, etc. And this is a real factor that compresses our lumbar spine and creates trouble. So if you've got lower back pain, immediately reducing the amount of sitting that you're doing on a daily basis and sitting better is going to be helpful. One great tip that we've got for you on today's video is using a small rolled up towel. Whether you're traveling to and from work, whether you're sat in the office, or whether you're sat at the dining table or out at a meal with friends, using a small rolled towel placed in the lower back to support the natural curvature will help tremendously in reducing the burden on those lower lumbar discs, particularly L4-5 and L5-S1 at the very bottom of your lower back. It's going to support that curve better and ultimately reduce the strain that builds up while you're sitting. Adding on to that, being a little bit of a fidget, switching positions. If you've got a sit-standing desk or have the ability to move around while you're at work, that's also going to help decrease the strain that sitting puts on your lower back and really help in that recovery process. Tip number two is really going to be talking about the inflammation that's building up in our lower back, and the way we can prevent that from getting worse is by moving more. And this means moving within a pain-free range. It could be taking short 5-minute walks around the house. It could be around the block for 5 to 10 minutes, but walking allows small amounts of movement to go through the lower back and help get rid of excess inflammation building up. One of the reasons that we're particularly sore first thing in the morning, or commonly are with lower back pain, or the sciatica that you're experiencing down the leg is particularly bad, is because inflammation builds up while we're still. It might build up while we're sitting down in the chair, and it hurts when we go to walk, which leads us to not wanting to do much activity. But if you can force yourself to do a little bit of gentle walking around the house within a pain-free sort of amount of time, this could be very short, then you're going to find ultimately you will feel better after the walking than you did beforehand. It'll limber up your lower back, help get rid of some of that excess inflammation, and ultimately help you be a little bit more mobile and help that recovery process along. It's a vital one. So just little bits of walking are going to really help. Just as a side note on this particular topic about moving is sometimes you'll be directed to exercises like knee rocks, where you rock the knees to left and to the right, or hugging the knees, or even things like child's pose. Those are examples of movement which are significant. There's a huge amount of movement as you pull your knees towards your chest. That is too much. It's not necessary, and it's undermining the principles of good lower back health, which we'll touch on a little bit later, the neutral spine. So make sure you're doing a little bit of movement, but you're not gravitating to those sorts of exercises I just mentioned, because ultimately they do make lower back pain worse, and they're worth avoiding. More or less everyone that has either seen us in clinic over the years or members that have joined the program have been doing those sorts of exercises. And when you get them to stop doing it and start doing the right stuff, it makes a huge difference. So cut those out, please. It really will help your back no end. Now, following along this inflammation theme, if you will, we're going to move on to the next point, which is contrast bathing. Particularly if you've got degeneration in the spine, a degree of stenosis, or some sort of disc bulge or herniation, using contrast bathing, where we do hot and then cold, hot and then cold, hot and then cold, for around about 3 to 5 minutes of each, following each other immediately, done a couple of times a day, can really help manage the excess inflammation that builds up in the lower back. You'll see a lot of stuff online nowadays about inflammation being a good thing. It's a natural process. It diverts resources and white blood cells and nutrition and oxygen to the area, which is really, really important. But in the spine, things are a little bit different. We have issues with the arrangement of space available in our lower back. Unlike our wrists, which can swell up and we can have a lot of inflammation there without really causing any problems, in the case of the lower back, this is very different. We have these small bony holes where nerves run through, and they can fill up very quickly. And as you'd imagine, they don't stretch very well. And therefore, we must have steps to manage that excess inflammation so that we can prevent it building up to significant levels and causing us pain or aggravation. And this really plays into what I've just been mentioning in the previous tip about walking a little bit more. So using contrast therapy, or hot and cold therapy, to help calm down inflammation is really quite vital. Now, we did a full step-by-step tutorial on how to do this, and there'll be a link down here in the description, so you can check that out after this video if you want to start incorporating contrast bathing. It's super easy to do, and more or less everybody can do it from home with stuff that you've got around the house. So this brings me to the next point, and this is a neutral spine. You must learn about your neutral spine. That is, your lower back should have a natural arch. You need to avoid exercises and practices which eliminate this arch. Sitting is one of them. When we sit down and we don't use that towel that we touched on earlier, you flatten the lumbar spine, squashing down on the discs and eliminating the natural curve in the lower back. But by focusing on maintaining that neutral spine, learning to control your core so that you don't eliminate it every time you sit down, and that when you lie down on your back, you don't do a pelvic tuck, rocking the pelvis back, flattening the lower back to the ground, you'll start to be able to support that natural, neutral, normal position of the spine. And that holds it in the best possible position to recover. If we start doing those other exercises, we mentioned pelvic tucks, knee hugs, etc., you're only going to be eliminating that natural curve and altering the way in which the spine is going to be load bearing. And this makes things like disc injuries and sciatica a lot worse in the long run, unfortunately. So please try and steer clear of those. So moving on to the next part, and these all kind of play into one another. You know, if you're able to manage the inflammation a little better, then you're able to maintain a neutral spine. And that brings us to this next point, which is keeping good mobility in the hips. Now, this is something which will play into the next point that we'll discover as well. And I don't want you to obsess over stretching unnecessarily. As your back gets better, your hip mobility will improve if you're doing the right sort of exercises. But keeping the hips mobile, that's the hamstrings, that's the glute muscles, that's the hip flexors, keeping them as mobile as can be through a degree of regular stretching, knowing full well that stretching is not a long-term solution, but a necessary practice like brushing your teeth every day. It will really help you ease the strain on your lower back while you're doing other exercises that are actually progressive and build stability in that lower back. So having hips that are mobile decreases the rate at which your lower back has to be involved in a movement. For example, if you're going down to pick something up, if you have nice mobile hips, you can bend at the hips and the knees to get down closer to the ground without having to round your lower back over. If you have nice mobile hips, you can slowly lower from the hips and the knees into sitting down in the chair rather than rounding your lower back like a prawn and squashing down as you hit the seat. So this plays a critical role, and it marries up perfectly with the next point, which is building strength. Now, ultimately, we can't just improve the mobility under load of our hips unless we have stronger hips. And a lot of people with lower back pain, especially if you've had it for a long period of time, will find that their hips are tight, but they're also very weak. They can't squat to an appropriate depth without the lower back being rounded and violating the principle we discussed earlier about a neutral spine. And therefore, we must take part in specific exercises to strengthen both the core, but also the leg muscles themselves. And we discussed this in a dedicated video on 5 core exercises that you can do for your spine. Again, link in the description so you can check that out after this video so you know exactly what exercise to do, starting on the floor with things like the modified dead bug without a pelvic tuck, keeping a neutral spine, learning how to do that, and then progressing on to other exercises that will build strength in your lower body, in your spine, and in your core, all in the right way in a progressive manner, going from the easiest without weight bearing to the best with weight bearing, building real strength in your lower back. And you will find that as you do that, your hips allow you to go further, and therefore your stretching that you're doing daily actually starts to become effective. But it comes as a result of doing proper strengthening exercises, not just obsessing with stretching over and over again. And we discussed that at length in other videos about back pain and how the tightness in the hips is developed as a result of lower back injuries, primarily because the little nerves at that L4-5 and L5-S1 level, if they're being aggravated by an injury in the lower back, they will be sending signals out to the glutes and the other muscles that we've discussed, hamstrings, etc., telling them to tighten up. So your stretching will only have short-term effects until you build strength to protect the lower back so the lower back can heal, so the stretching can actually be effective and cumulative rather than just being undermined every single day. So then that brings us to a nice little stretch that you can do, which is the decompression stretch for your lower back. And again, we've got that towel we mentioned at the very start, and we're going to roll it up nice and tight into a cylinder, a little bit smaller than a foam roller, and we're going to lie back over that. And what this is doing again is supporting the neutral spine, the natural backward bending curve, and decompressing, taking pressure off the discs and taking pressure off the muscles and ligaments that are going to be tight in that lower back. This is a great stretch and one of our favorite stretches for everyone that everyone can do. And again, we've got a dedicated video where we discuss the towel stretch and a couple of other safe decompression stretches for your lower back that again don't violate that principle of maintaining a neutral spine. And that again is a link in the description. You can check that one out after this particular video. Then we move slightly in a tangent because people often overlook this next one, and that is going to be a healing diet. And this isn't any crazy foods. There's nothing, that you've got to work hard to do. It's just making sure that you understand that there are two things that are taking place in your lower back when you're trying to heal effectively and the surrounding tissues. Number one is that something that is injured, which will be a tendon, ligament, muscles, etc., is trying to repair, and it needs resources to do that. And most of that, if not all of that, is going to come from primarily from protein. So you need to be making sure that your diet is including sufficient amounts of protein every day in order to effectively meet those needs so you can recover the injury. That's what it's made out of. It's not other stuff. It's protein that's broken down and then reconstituted to create the patchwork to mend that particular injury that's there in the lower back. The next thing that's happening, number two, is that you are trying to build muscular strength, build support for that lower back, be it in the core or down in the leg muscles. Again, where does that come from? Very, very simple. It comes from protein. And we did a full review of a very good book that we recommend to anyone trying to recover from back pain to address the diet side of things, called Forever Strong by Dr. Gabrielle Lyon. And I'll link again to that review, the book review, and a book link down there in the description to check that out. Because in the back of that book, she's got some practical steps to make sure that you know meals that will help you get the right amount of protein and how much that should be from your diet every day. If you get that right, then you're going to really support and turbocharge your recovery process. And from our experience, too many people that have long-standing lower back pain, especially as you get to that age of sort of 50 and above, they really struggle with completely overlooking this particular fact of or aspect of nutrition and supporting that recovery process. So do not make that mistake. It's such an easy one to do, and it really can make a dramatic improvement in the results that you get, both in your short-term rehabilitation, but also your long-term healing too. And then this brings us to the last 2 points. Number 9 is really about getting a bit of expert support if you need it. Ultimately, you can muddle along on your own. You can try and do things your way, and you can try and piece things together. We've covered some great tips that are going to really help you in this particular video so far, but sometimes getting expert support can really help. And that could be by way of treatment. If you're in the local area around Cheltenham in the UK, then you can always come down and visit us at the studio. We've got some of the best treatments here to help you recover from low back pain and support the rehab process that you're doing at home. If you're not, we've got 2 additional resources to help you. Number 1 is a full back health masterclass. And again, link in the description. That's a free video. It's on the YouTube channel, and there'll be a link just down here in the description for you to go and check that out and watch that. It's a detailed deep dive. It's about 80 minutes long, and we'll go through everything that you need to do to help you fix your lower back pain. So check that out. And then the final one is, if you need a little bit more help, then we've got the full Back in Shape program, membership to the program. Maybe you're somewhere else in the world, as many of our members are all over the place, and you need a bit of help, then that expert support can just help you bridge the gap between where you are and where you want to be and give you a solid action plan and support along the way. Yes, many things we can fix on our own, but if we've been struggling with lower back pain, why leave it to chance? Why continue to allow it to get worse when there are proven strategies and support networks that can really help you get there faster and ultimately get there with less relapses along the way? So definitely check that out. And that leads me perfectly into the final point. The reality is, unlike a broken arm, unlike a strained shoulder or any other issue, you can't put your lower back on the shelf. It's going to be used every day. We can't even put it in cast, and we can't use supports, etc., because those undermine the healing process and they make things worse fundamentally. You need to expect that there will be relapses along the way. There's going to be bumps along the way. But as you build strength and observe some of the principles and use some of the tools that we've discussed in this particular video, you will find you make significant improvement, and you find that those relapses and flare-ups happen less frequently. You recover from them faster, and they are less severe. Expect them, embrace them, because quite often they will come in areas or from things that you need to learn to overcome. They hold clues, they hold secrets or keys to unlock the next level of progress. It might be that you got a bit of a flare up on a particular exercise. What did you do wrong? Learn that and discover what it is that was wrong, maybe with some expert support, and then move past that point. And you'll find that if you embrace those bumps along the way, learn from them, you will have a much more complete healing process, and you will dramatically reduce the risk of future episodes of lower back pain in the future. So that's the 10 things. Hopefully, well, that's only 5 of them. That's 10 things. Hopefully you found it a helpful video and helpful episode of the podcast. If you do have any questions, as always, there's that comment section down here. You can always reach out to us by DM on one of the platforms that you're watching this on as well. We read and reply to all of your comments. And of course, thank you for making it this far in the video. We look forward to seeing you in the next episode of the Back in Shape podcast.